My name's Pete Simi. I'm an associate professor of sociology at Chapman University.
This is Dr. Lorenzo Norris, Editor-in-Chief of MDedge Psychiatry. We are pleased to have with us today Dr. Simi, who is going to be speaking with us about a really important topic, and that topic is white supremacy. So I encourage all of our listeners to stay tuned as we're going to engage in what I would hope will be a productive as well as a critical, well thought out dialogue about thinking about white supremacy in ways in which we may not have thought about it before. So please stay tuned and listen to myself and Dr. Simi discuss this really intriguing topic. Dr. Simi, welcome to the SiteCast.
Thanks for having me. Appreciate it.
So, Dr. Simi, the topic of white supremacy is not a new topic. It has certainly been a part of our this country and this culture for quite some time. For various and obvious reasons, the topic of white supremacy has garnered increased attention in pretty much many aspects of the media as well as folks' everyday life for a variety of reasons. Now, Dr. Simi, you have done a good bit of work, and I've enjoyed reading your articles in regards to how you think about white supremacy in a critical way, how you start to look at all the various factors, and I would dare say challenge us in regards to some of our thoughts or lay thoughts or, if you will, stereotypes involving white supremacy. My first question to you, Dr. Simi, would be, how did you get interested in this field? How did you get involved in this? How did your career path take you into the topic of white supremacy and studying it?
Well, professionally, it's been an area of work that I started in 1996, shortly after the Oklahoma City bombing. And I started doing field work with active members of different types of anti-government and white supremacist groups. Prior to that, though, it's kind of a long and windy road in terms of personally what drew my attention to it, because I did start thinking about this issue at a very early age for a variety of different reasons, things that happened in my own personal life, things that I was noticing in terms of family, neighborhood, friends, but also things that I was seeing. I remember at the age of 5 watching Roots, the miniseries when it first originally aired in 1977, and that had a dramatic impact as a 5-year-old, seeing the brutal representation of slavery and everything that went along with that. So that, those kind of things. I saw a documentary at a pretty young age about the Ku Klux Klan on PBS, and a made-for-TV movie about the desegregation of Central High in Little Rock, Arkansas. And all of these things, along with things that I was seeing in my, like I said, my personal life, really kind of, I guess, I developed an early consciousness about the problem of racism and hatred in our society, and I wanted to try and understand where it comes from, the different manifestations that it takes, how individuals get drawn into it. And so then, when I was in graduate school, I started looking into it more formally, from a professional research perspective. And I initially started looking at websites in 1996. This was the early days of the internet. And of course, by then, white supremacists were all over cyberspace. And in fact, they'd been using electronic bulletin boards going back to the 1980s. So that was fairly easy for me to start to be able to look at actual websites that were promoting different types of propaganda. And then from there, I was able to make contact with a group in the winter of 97 that allowed me to spend time with them. And initially, they met me for lunch to kind of vet me and check me out. And they said that depending on how things went, they'd be willing to basically show me the movement, as they put it. And so we had the lunch meeting. And from there, they invited me to come back and stay in their homes as a guest. and I could just, observe their lives. And that's exactly what I wanted to try and do, to see what happened. What is a person's life who gets involved in a group like the Ku Klux Klan or a racist skinhead or neo-Nazi group? What does that life look like on an everyday basis? And then, what are the collective events that they are involved in? What does that look like as well? And so from there, I was able to attend cross burnings, swastika burnings, church gatherings, neo-Nazi music shows. And that work continued for a number of years. And then more recently, we've been interviewing former members to try and understand not only how people get involved, but also the factors that lead to their exit, and what their lives look like after they leave. So this is this type of work I've been doing for about 25 years now.
Dr. Simi, thank you so much for just sharing that with us, and just hearing your journey into the work. I'm even more interested in hearing more about um, just what it was like to be observing, working in those in a very intimate way in the life of those involved in white supremacy. But I did want to take a moment to just acknowledge, I appreciated that you went back to, because we were in the same age cohort, because you said 1977 and Roots and being 5 years old. And I appreciated you saying that, because for many of us in that generation, I always think of Roots as a movie, as a very defining thing that's etched in my memory, and thinking about how African Americans were treated and portrayed in that movie. And it's challenging to explain it to another generation or different generations if you weren't there, what that felt like, and particularly with the state of the country, and also witnessing that, seeing that movie at a very young age. Because as a 5 or a 6 or a 7-year-old, you're kind of thinking about that, like, whoa, how do I process this? So I appreciate you talking about Roots, because similar from a different vantage point, I remember seeing that movie, and I was just kind of, I have to be perfectly frank, I had a difficult time processing it in terms of like everything that was going on. So I thank you definitely for sharing that journey. Now, going back to what you said, it sounds like in 1996, you first made contact. And I want you to maybe tell us a little bit about what it is that you observed in the daily lives of the white supremacists that you were exposed to, and particularly as it relates to, maybe if you could comment on early childhood experiences, or what is this, how do in your mind, how do people, those factors, become white supremacist?
Sure. So in terms of what I directly observed, it's hard to describe in a way, because it's a combination of very mundane things. In many ways, the individuals that I met, they weren't all that different than a lot of other white people I'd gone to school with, grew up with. They were pretty typical in many respects. And yet at the same time, they'd come to organize their lives around some very extreme ideas, and in some cases, including violence. And by that, I mean, they were decorating their homes with, say, Nazi paraphernalia.
Mm-hmm.
They were listening to neo-Nazi music. But they were pretty ordinary in other respects. So it was a weird combination of both kind of extraordinary and ordinary. And I think that's important, because I think sometimes we think of the individuals involved in these groups as exclusively on the fringe. They're totally
Mm-hmm.
separate from the rest of society. And society creates these groups. They come from us. They are they are a product of our society. And in many respects, we find individuals, for instance, there's no single profile in terms of socioeconomic background. You find people from upper class backgrounds, middle class backgrounds. It's not exclusively people with low levels of education or from lower socioeconomic status. So you get a wide cross section of people who get involved in these kind of groups and are attracted to them. And we tend to find individuals, in terms of their family socialization. One of the things that kind of sticks out is that oftentimes, they're not necessarily raised by relatives who are members of these types of groups, but they are socialized in ways that, where they're learning ideas that are consistent with these more organized white supremacist groups. What I mean by that is they're hearing racist jokes, in the home from their parents, or they're hearing the expression of racist slurs. They're hearing ideas that really, they're different than what they're going to ultimately embrace in terms of the more extreme organized propaganda and conspiratorial ideas that they eventually come to embrace. But it's not that big of a jump for them, because they've been socialized with this more what you might call everyday racism, or more ordinary racism. So that's happening. At the same time, we're finding that oftentimes individuals, at least what they're reporting to us, is that their childhood and adolescence is marked by a lot of instability. Not socioeconomic, but other types of instability. So experiences with physical abuse, sexual abuse, parental neglect, substance abuse in the home. So while their socioeconomic status is quite stable, there's these other instabilities in their life that's happening and is creating certain kinds of vulnerabilities. And as they grow into adolescence, they themselves start experimenting at an early age and engaging in certain types of misconduct and delinquency. And so their life is kind of spiraling out of control by late adolescence. And oftentimes when they come in contact with more organized white supremacist groups, in a way, it's kind of an odd type of coping mechanism for them, because they see the group as providing them with some stability to their life. Okay. And that when they embrace these ideas, it's going to give them some kind of comfort.
Okay. All right. That's Dr. Simi. Just following up on this is to me very fascinating. Is there, let's say we take this combination, as you said, the combination of the mundane and the extraordinary. Is there a point, or is there something that you have seen or observed that tilts somebody like past just, if you will, engaging in everyday racism, and tilts them more into, if you will, formal white supremacy? Is there a constellation of factors? Is it difficult to predict? But is there something like that? Because I would assume, and I could be wrong on this, that as you said, there are many, I won't say many, but of the groups that you have observed, I would imagine not everybody in that group or that dynamic or that social structure ends up going into like formalized or extreme white supremacy. So is there a point or a transition point that you've come to see?
Yeah, it's a great question. I would say first that it's very hard to predict any of these things prospectively, because of the complex nature that we're dealing with and the combinations of factors involved. And oftentimes the patterns that we find apply to a certain portion of folks, but not comprehensively. And so in other words, there's different kinds of combinations that exist too in terms of the patterns. And when I think you're right to point out that, so we have a much larger pool of people who engage in everyday racism. And that's bad. That has a lot of negative consequences for society. Fortunately, though, there is a smaller portion of people who go from that more ordinary or everyday racism to the more kind of extraordinary organized white supremacist extremism. There's a much larger group of folks who engage in that ordinary everyday. And so what tips a person towards the more extreme? I think it's a number of things. I think when a person has additional vulnerabilities in their life, so they've been accustomed to the everyday racism through the socialization process, through larger culture, and then they have additional vulnerabilities those vulnerabilities can create a tipping point. It's also exposure to the group. So, and especially pre-internet, exposure to the group was, in some cases, could be difficult. If a group wasn't in your immediate area and in your immediate environment and you had to reach out to them, it might be, involve writing to PO boxes in order to try and get literature and whatnot. So it was fairly difficult to find these groups to some extent, unless they were active in your immediate environment. And that chance for kind of chance encounters, which actually plays a role here. And we do see that in some cases, you've got a person they've been exposed to the everyday racism and they're expressing that. they have some additional vulnerabilities. But what the ultimate tipping point is the chance encounter with a white supremacist recruiter, for example. And that might happen for young people at a music show. It could happen for older people at the workplace. You know, somebody pops into somebody unintentionally, accidentally. They meet somebody at work who's already involved in one of these groups, and a conversation starts up. And the next thing you know, they're being introduced to this more organized white supremacist propaganda. Now, I should say today we live in a very different world because of social media and the internet. So now that's changed a lot of things that I've just said, but certainly, you know, pre-internet that was the case.
Well, you know, that's very interesting. I mean, here's some thoughts that come to mind when I think about the what you just said in regards to the tipping point or the chance encounter. One, we can say vulnerability. We can say a lot of different things, because I mean we're focusing on white supremacy, but I think that this also could apply to individuals prone to any form of extremism or any type
Absolutely.
of some. And I think about um, sense of identity and being, if you will, in this fluid or lost state. I hesitate to use that word, but I will, because I think it can apply to many folks. And I think of folks looking for something and being vulnerable, and then the chance encounter. But I like the idea of the chance encounter that you brought out, because the chance encounter could actually go multiple ways. You could encounter a white supremacist, or you could encounter you know, a professor, or you could encounter a track coach. You know, take your pick. You know,
We've actually had a lot of people tell us that.
Yeah. You can encounter a lot of different people. So I really think it's important that I just wanted, because it resonated with me, and maybe it'll resonate with the audience, that those chance encounters, we all can be a part of that, and that makes a lot of difference in our life. Particularly, all of us can relate to being young adults, and that a part of that critical point. But you also mentioned adults, and I do think we do have those chance encounters at critical periods in our life. We've been using the term everyday racism.
Mm-hmm.
I personally, on this podcast, am fine with the use of that term. I
Okay.
don't want people to think that we are playing down or watering down racism, or making it seem as though it is like, you know, okay, well, everyday racism, like it's okay. No, I think, and I don't want to put words in Dr. Simi's mouth, but I will tell you what I think about that. When I think about everyday racism, that speaks to how much ingrained it is in our daily lives, and that if we are not aware of it, we are not aware of its power and its influence. And that, I think, is another way. It's not quite the same thing, but when we talk about systemic racism, I think that that's another way to think about it, whether people agree or disagree with it. I just wanted to make it very clear that, at least in this podcast, when I believe that Dr. Simi and I are using everyday racism, that is not to equate with that everyday racism is okay. That is to really just point out the ubiquitous nature of it, and that you must constantly be aware of just how powerful it is in your everyday life if you're not actively aware of it and addressing it. So I just wanted to put that out there, and Dr. Simi can add to that as he sees fit, but I wanted to make sure that the audience heard that. But now, Dr. Simi, please.
Yeah, thank you for doing that, by the way. And let me just I think it's a
Please.
real sad state of affairs, the fact that everyday racism is essentially
Yep.
normalized.
Mm-hmm.
And that's just, again, an assessment of where we're at as a society and as a culture, where we've been, but where we continue to be, that it is normalized. And I think we have to first have an honest appraisal of that fact before we can really interrogate it.
I agree with you completely, Dr. Simi. Now, continue with our as you're giving us this walk, or this journey down the path towards white supremacy. The person has had that chance encounter. All right, they've had potentially early adverse life experiences, that chance encounter, and now they have actually been introduced to formal white supremacy. What are the next things that you have observed?
Yeah, so this is where, it gets interesting in some respects, that some of the people we've talked to, we wonder, like, when that first encounter, why didn't you turn tail and run? You end up at a Klan rally or a Klan barbecue. I'm thinking of one person in particular who almost their chance encounter was almost as a lark kind of thing they did for kind of a prank type thing, where they wanted to see what the Klan was like, and they got set up in this meeting deal, and they went to a Klan barbecue and meeting, And instead of turning and running, though, they embraced it. And I think this is true, generally speaking, for a lot of the folks who get involved in these groups. Is that initially, at first, they see a family. It's a
Mm,
kinship, and that's what they're promised. Is, these groups really focus on the idea that we're a big racial family,
mhm,
and we're all brothers and sisters as part of the white race, and we take
mhm.
care of each other, and we look out for each other, and a sense of shelter and protection and camaraderie. These are all their selling points that they really do, in some ways, an effective job at promoting, in terms of
Mhm.
through their propaganda, but also in terms of through their interactions with each other, at least on the surface level. They have events where they engage in what they call fellowshipping. For example, I spent time up in northern Idaho when Aryan Nations had their 20 acres of property up there, and they'd hold events. And they called the events, in terms of the networking part of the events, they called that fellowshipping. So there's this real sense of brotherhood and family, and sisterhood, that permeates the environment. And so for people that are kind of searching for that, they're searching for an identity, they're searching for a place in society, they feel lost, as you said, that's really can be quite attractive and appealing. And then that gets coupled with the idea that you're going to be part of a special group of people who possess a certain kind of insight that no one else does. We're going to
Okay.
tell you secrets about how the world actually works.
So again, I go back to what you just said, that sense of family, that sense of belonging, and I would imagine over time, and once you have that sense of family belonging, acceptance, self-esteem, that can also start to get into the idea of a certain sense of power. All
Yes.
right, and again, that is, and absolutely, in my opinion, a component of racism, which is why racism is so incredibly, I would actually use the word addictive.
Mm.
But that sense of power. So what is it? Okay, so you have the kinship, you have the family, you kind of have this tribalism. If well,
Hmm.
yeah, I'll say tribe. All right.
Yeah.
Um, and this sharing of secrets and then abilities. What is it with these groups? Is violence inherently a part of the group? Because I don't, they educate us. Is violence inherently a part of white supremacy or extreme groups, or are there different factions? And later, it just is like, do they actually break off from even that group into another splinter group that advocates for violence?
I would say all of the above.
Okay.
Inherently, white supremacy is organized around racial domination,
Okay.
and that inherently involves violence. So that cannot be, you can't get around that in a way.
Okay.
But some groups try to. They really work at the idea of we're not violent, and there are other groups that really do completely, overtly, and without any pretense say, oh no, we are completely about violence. In fact, we don't want a race war in the future, we want a race war today, and we're going to
Okay.
do everything we can to help bring about one.
Okay.
So you do get some, kind of level of distinctions in that respect,
Okay.
but I would say inherently white supremacist extremism is absolutely organized around violence, and it
Okay.
comes out in how they talk to each other on a daily basis. That's one of the things was probably one of the more difficult things for me to be around and observe directly, was the amount of violence that's discussed, like you're discussing the weather, basically.
Okay. Really? Can you maybe give us a bit of an example of it with obviously um, you using whatever appropriate language you can. But
Sure.
what could you give us an example of what you might be seeing?
So two things come to mind, or two types come to mind. One is humor is very central to the culture, and racist humor is very violent oftentimes. And so there'll be jokes about gassing Jewish people, lynching Black people, so forth and so on. And then there are non-humor types of talk that are more kind of fantastical propositions about the kind of violence they'd like to enact on the people they consider to be racial enemies. Which, by the way, I should mention, includes what they call white race traitors. And so any whites essentially who are supportive of multiculturalism, engaged in interracial relationships, so forth and so on, they're considered to be traitors to the race, and according to some, they're going to be the first ones to hang when the day comes.
Okay. Oh, okay. Now, again, let's go back. Let's go back. There are the two groups, the ones that, or not, there's more than two groups, but
Yeah,
inherently racial domination is about violence. In some way, it's always, and it always will be. But there's some groups that don't put it out there outright.
exactly.
Is there, I actually could see that as additional, whether it's talking about racism, racist humor, then that first chance encounter, and the groups that don't always put themselves out there in terms of violence is like kind of a gateway or another
Yep.
entry level into this. Is there something in particular that those groups that don't advocate direct violence, what do they say? What kind of messages do they give folks?
They'll focus on political, like more conventional
Uh,
politics. Some of it might be institutionalized in terms of like running for office and so forth, or more holding protests and rallies, nonviolent protests and rallies. Doing things. I mean, even I was just on a Telegram channel the other day, and they were talking about food drives. It was a white supremacist Telegram channel. So even things like that that you wouldn't necessarily expect. You know, of course, it's food drives for white people, not anyone else.
mhm.
But nonetheless, it could be a whole gambit of that type of activities, different kinds of community-based activities, even.
Okay, I see. And I'd imagine it was interesting you were talking about Telegram, or was it, did you say Telegram or
Yeah, yeah, Telegram, the
Telegram?
platform. Yeah.
Right, the platform, okay, which has definitely been in the news recently. You were talking about Telegram, and I'm thinking about what you said in terms of family and kinship, and I'm imagining a very close, completely confined circle in which no other information gets in. And these messages keep getting reinforced, reinforced. And the question I would have for you is, when, from your observations, does it get to the point to where the beliefs become fixed? Like you're not going to be able to, it's now they are, for lack of a better word, locked in without some type of extreme intervention, or it just, or you understand what I'm saying? Like
Yeah,
at
no,
what
I do.
point is really the point of no return?
Well, so here's the good news. I don't think there is necessarily in that,
Okay,
because a lot of the formers we interview were locked in hardcore and were committed for, in some cases, well over a decade.
okay,
So, but I take your question in another direction, which is I think you do once you I think you do have folks who are kind of dabblers. In other words, they're on
yeah,
the periphery. They like to dip their toe in. Maybe they go hang out every once in a while. Maybe they go to a music show every now and again, something like that. Maybe they do some stuff on the internet, but they're pretty peripheral, and that can go on for quite a while. But once a person starts to really organize their daily life around it, then now they're getting locked in, and that's where what a lot of the people I was spending time with, they had done that. They really they're everything from kind of sun up to sundown in some way or another kind of revolved around it,
okay,
and their beliefs, their involvement in the movement.
okay. Well, that I have to tell you, that is a really, gosh, yeah, just that's a very disturbing prospect. When I think about that, because the next question I have is like, okay, you have dabblers, and then you have this situation where it becomes a part of your daily life, and I would dare say a defining feature. Do you have any data in regards to what percentage of those where it becomes a defining feature? How many of them actually come out of that? And I know that's kind of a tough question, but
It is.
yeah,
Problem is we don't have the baseline number, so we don't know how many of these people exist across the country who are the hardcore committed. So we have a certain number of people we've interviewed who were hardcore committed and have left, but we just don't have that baseline number. So it's kind of impossible for us to say, well, it's 20% or 40% or something along those lines. We just can't
okay,
get to that number. We just
okay.
don't have the baseline.
All right. Of the ones that you've talked to that have left this life, who have left white supremacy, did they identify something as a triggering event or something that occurred, or is it all over the map?
It's pretty much all over the map. Here's what we find, generally speaking, in terms of the pattern of process, is that it's not a moral reckoning initially that seems to spark their disengagement. It's more a lack of personal satisfaction. So in other words, people get involved thinking they're going to have certain needs met by their involvement, And, there's all this promise about the brotherhood and the family and the this, that, and the other. Well, once they get involved, at some point, oftentimes they're going to start to see things that don't quite add up. In other words, there's
Okay.
a lot of infighting happening in groups, a lot of backstabbing, a lot of hypocrisy. Groups will say they're totally anti-drug, one minute, but then they've got members who are hardcore drug users at the same time.
Okay.
So there's these contradictions. And as individuals are experiencing this, they start to experience less and less satisfaction. So there's this building dissatisfaction personally that seems to start to create distance between them and the group they're spending time with. Now, in some cases, that person simply moves on and they join a different, because there's all
Okay.
kinds of these groups out
Hmm.
there. So if you want to leave one, you can go to another without much effort. So, and that does happen, but other times that distance gives the person a little space to start to reconsider. And if they're building relationships outside of the movement and getting kind of pulled in a new direction, then that's even more likely to create a sense of questioning about what it was they were actually involved with. And then that moral reckoning, if it happens, and it doesn't always happen, but if there is a moral reckoning, it seems to happen a little bit later in the process.
Now, for those, you wrote a really good article that I read, and I wanted you to talk a bit more about this in regards to the challenges of those leaving white supremacy have in, giving up that identity, and how in certain ways it has many, you know, correlates, if you will, in certain ways with addiction. And Dr. Simi, I was wondering if you could like help the audience and myself understand what that is, because I found it fascinating when you brought that up or in the article.
Yeah, absolutely. So, when you think about leaving one of these types of groups, a person might think, well, geez, I bet there's a lot of physical danger, and there can be. But in many respects, what's even more difficult about the leaving is the identity transition, having to redefine yourself outside of your involvement in the group. And it's important to recognize that, again, as we were talking about these folks where it's sun up to sundown, where your life is centrally defined around this really involves, not always, but in many cases, a totalizing commitment. So it's your master status, your master identity of who you are. And so giving that up is, really requires a substantial change in a person's life. And it's not just a change in thinking, but it's a change in feeling, because a lot of this is about emotion. A
Mm,
lot of why people get involved in the first place, it's about feelings. It's about feeling a sense of isolation, a feeling of disenfranchisement, dispossession, fear, anger, frustration. And so redefining oneself and redefining one's beliefs also means redefining one's emotions and how they approach the world from an emotional standpoint. And these groups teach people to approach the world in a very emotionally stunted way. The level of EI, emotional intelligence, in these groups is
hmm.
quite low, as you can imagine. And so now a person is having to deal with all this emotional baggage, all of this kind of cognitive aspect of the beliefs that they've come to embrace, and then the social, right? So now their support network is gone, their friendship network is gone. They may have family support outside, they may not. They may have other kind of parallel problems as well. They may have substance abuse problems that join their ideological extremism. So there's all these different things happening in the person's life, and that identity of white supremacy is still there, anchoring them in some respects, and is still there, offering them
Mm,
safety, security, familiarity. And so pulling away from that, we weren't looking for this necessarily when we were talking to them. They were telling us about involuntary and unwanted residual that they continued to feel. And I'll just tell you about one interview in
please.
particular that stood out. It was a middle-aged woman who had been out for a number of years. And during the interview, she repeatedly said, over dozens of times, almost pleading at points, I can't get rid of the hate. The hate won't go away. I try and try so hard, and I just can't get rid of it. Various versions of these kinds of statements she just kept making. without us prompting her, and talking about this kind of involuntary and unwanted. And she actually even described, her spouse actually reminded her to describe a recent incident she'd had at a fast food restaurant where she had gone through the drive-through, and when she finished at the drive-through, she looked in the bag to check the order, and she felt like the order was wrong, so she parked and went inside. And one of the employees was Latina, and she started talking with the employee, and they said, well, no, this is what you ordered, and it's right there in the bag. And she got very irate, and before she knew it, she was spewing racist slurs at the employee. And then she kind of turned and stomped out and did a Nazi salute on the way out the door and yelled white power. And by the time she got to her car, she kind of like came to, and it was almost like she had been in a trance of some kind, or she felt like it, and she's crying, she feels ashamed. Just retelling the story, she's crying and expressing shame about this happening. So it just really underscores the deep kind of penetration that this can have in a person's psyche, and cutting to the core of who they are.
Right. And Dr. Simi, thank you for sharing that with us. A question I have, did she happen to elaborate while she was engaged in this behavior? Did she say how she, other than angry, was she able to say how she felt? Did she feel powerful? Did she feel like a high? Did she feel an elation? Did she mention what she felt
Yeah,
beyond just the anger?
yeah. I mean, I think because it happened so fast, and she did kind of go almost like a blackout type deal, a trance of sorts. But she did, the way she was describing it, it sounded like kind of a sense of power and a release of frustration.
Okay.
Kind of she had all this frustration building up about, and it wasn't just the incident. This person has lots of other challenging things happening in their lives, including their stepfather shooting their daughter in the head, and the daughter being permanently brain damaged. So this person's life is filled with trauma and other challenges, kind of going along at the same time as she's trying to transform herself away from white supremacy. And it sounded like that kind of going back to that gave her some sense of release from a lot of different kinds of built up frustration.
Okay. All right. This is, and give me some rope with this one. This makes a lot of, and I think listeners in the audience will make, we're as we put this together, I've learned over time, my patients have taught me this as well as the world, when you have like just anger, I learn to look for trauma. I look for particularly early on trauma. And I will speak for myself, but until that trauma is addressed, that frequently puts a cap on any type of gains that we're going to make in regards to development. Now, in regards to dealing with the anger and the trauma, we can use many different maladaptive behaviors or things or substances. It doesn't matter what it is, whether it's gambling, TV, social media, in this case, white supremacy. But if that becomes a way to stop the pain, and particularly the ways in which we stop pain involve a sense of power or elation or a high, I'm not equating what this person went through with, say, someone coming off of a high from ecstasy or crack. I will tell you though, or PCP for that matter, I will tell you though, that there are many similarities in regards to someone experiencing an unnatural high or something used as a coping mechanism or technique, whether it's gambling or this, that, or the other, that this kind of triggered in me. I'm not an expert in, if you will, addiction medicine, so I would have to bring somebody else on the sidecast for that. But what I'm saying is there are many parallels. And those parallels that I hear you talking about is, again, pain, and then doing something to cope with the pain. And then obviously the thing that you're doing in and of itself can have its own level of withdrawal. But that's what I think of. I think of that. And more importantly, the pain that the person feels when they come out of that stance. Now that I've seen that multiple times when I'm in an ED or in the front lines. When people actually come out of it, they feel like hell. But the residual or the pull, it's still there. I go back to some of my training. Thank for all the people in the Bronx, VA, Mount Sinai for the training. And I want to say it was Mr. Benson. I may have forgotten his name, Mr. Benson. It was an anger management group. And people said, everyone would always congratulate folks after a year, but he never would, because he said there was still work to be done and people were
Mm.
still dealing with the sequelae even a year after. So that story, Dr. Simi, that you shared with me as well as the audience, those are things that it made me think about. And I encourage the audience to think about this and certainly put your own thoughts in the chat or whatnot. Again, because I think it's going to make us start to think about white supremacy, perhaps in ways in which we haven't. Dr. Simi, please continue.
Well, yeah. So, I think that's a great summary for where, the parallels, we were, with that article, we weren't suggesting that it's the same as heroin addiction
Right.
or other. It seems like maybe the closest parallels might be in the behavioral addiction realm.
Hmm.
You mentioned gambling. Seems like it might have some very interesting overlaps. But we did, want to emphasize this, and you get some pushback, especially in sociology, going
Hmm.
to that kind of level in terms of using addiction talk, which is
Right.
obviously a controversial concept in many respects. But we still felt like it was important because it gave us some kind of leverage point to understand this aspect of the experience. But then, of course, you get into the issue of people saying, "Well, you're medicalizing white supremacy, though." So, well, no, we're not doing
No.
that. but that's the confusion.
Right. And I think that one of the things we have to ask these hard questions, and I'm sure this is going to be what we just put out is going to be controversial. And I'm sure we may get some certain responses. And I look forward to those responses. But we have to ask the questions. Back to this idea, though, that you just kind of started to bring up, Dr. Simi, of perhaps let's talk about mental health problems in those with involved in white supremacy. And again, depending on like in terms of the research, there's been research that, per my understanding, that in terms of white supremacy or terrorist activities, I'm not equating both as the same thing. Let me be clear about that. But that people involved in those groups or movements do not have an increased mental health burden any different than that of the typical population. But what has your research shown, or what would you like to start to maybe encourage the audience to think about in regards to mental health and of those engaged in white supremacy?
Yeah, well, like addiction, the topic of mental health more broadly as it relates to terrorism, or in our topic here, white supremacist extremism specifically, is another controversial topic. One of the things I should just say is, look, we do these intensive life history
Hmm.
interviews with people who are involved either currently or formerly in these groups, and we ask them questions and they report. And obviously, sometimes the information you get through these types of self-report methods is not accurate. But for instance, like with the mental health questions that we ask people, we ask, have you ever been diagnosed by a physician with some type of mental health issue? Okay, and if they say yes, then we ask them more probing questions specifically. So you can imagine, I mean, that's a pretty high threshold because you have a lot of people who have mental health problems that have never been told that by a
Hmm.
physician. And yet we still find more than half of the people we've interviewed say that yes, they have been. So that's a quite a high percentage, and we find even higher for people that report that they've been suicidal at some point in their life.
Okay.
So we're finding some pretty strong indicators of a substantial presence of mental health issues in our sample, at least. That is a
Okay.
little different than what some of the research more broadly in, say, terrorism studies has found, which tends to suggest that this is really not present. And it may be that in some extremist populations it's more present than others.
Hmm.
And since white supremacists have been relatively neglected from, say, the terrorism kind of field of study, then it could be that this is somewhat of a unique characteristic for white supremacists. That's a different question. I can just tell you what we're finding, that there is this substantial presence. And again, it's not to say that mental health caused them to become white supremacists, but just that there is that presence that may create an additional vulnerability, along with some of the other things we were talking about earlier in terms of the childhood and adolescent experiences with adversities and trauma and so forth.
Well, thank you for going into that, Dr. Simi. I want to follow what you just said there. My interpretation, or kind of how I think about it, is you're not saying that mental health issues cause anyone to become a white supremacist, but certainly that we have to be aware and mindful that these issues most certainly can exist. And I'm using mental health in a broad umbrella, if you will, sweeping term. But some, as you were talking, I mean, the thing that I've just thought about is that racism affects us all in this country,
Absolutely.
period. And I think regardless of where you're at, racism is a part of the fabric of this country, and how every single one of us, myself included, this might be a controversial statement, but how we all continue to, yeah, leave racism, give up racism, because as you said before, a lot of it starts with minor jokes in your
Hmm.
home that nobody sees. And we all know that, or not know that, but I mean, but we've all been privy to that. But until we, again, I don't want to take the substance use and like kind of imagery too far, but I do. I'll think about smoking as an example. Um, you don't see a lot of smoking around anymore, even though it's still prevalent. But you don't. People, you go outside. People don't. You just have to really realize what it is. And I view racism as it affects us all. But one of the reasons that it stays is because I actually view racism as, again, another form or manifestation of how we exercise power or dominance over each other. And that's and power is very addictive.
Absolutely.
I will say that power can absolutely be very addictive, particularly if that's the chief way in which we've been, whether it's in the fabric of this country, we develop our, our sense of self or self-esteem. Dr. Simi, I want to ask you a couple more questions because I'm just so
Sure.
curious about your work. Now, you're on this podcast and you're talking to me, and whether or not people who know the psychiatrist, like, I'm an African American male psychiatrist. I mean, and I don't know whether the folks that you're talking to follow you or if they see what you're saying and all of this type of stuff. What is their response when you talk to them about your work, or even that you were going to be on a psychcast, perhaps talking to a Black psychiatrist? Do they have any thoughts about that, or would they even care? I mean, I don't know. I
Well,
mean, seriously, I'm just asking now. I mean,
yeah,
that's
yeah, yeah. I mean, so many of the formers that we've interviewed, to be honest with you, I've become, in some cases, quite good friends with, because it was a very different experience. The relationships, for lack of a better term, that it was building with active members in order to do the research, wasn't really becoming friends with them. I was trying
right.
to build enough rapport that we could have co-presence in the same environment. But those relationships certainly don't continue. I don't have any contact, and I do get, occasionally I'll get some threatening emails and so forth. And over the years, certainly got a lot of threats while I was doing the field work. A lot of death threats that if it turns out you're a cop, we're going to hunt you down, that kind of thing. I've had some, based on media appearances. I've gotten some. I had a situation with white powder at my previous university, at the University of Nebraska, was mailed to me that turned out to be, fortunately, wasn't anything, wasn't anthrax or anything. So I have had some occasions where things like that have happened, but it's usually anonymous. The threats are usually anonymous, so I don't know. And I don't do a lot on social media, which I know a lot of folks doing research in this area who are also very active on social media. That tends to generate heightened levels of threats and so forth. So the fact that I'm not social media savvy helps me in that respect. But as far as like formers who I've developed relationships, they're happy about the kind of conversations that we're having. And in fact, some of them take part in these kind of conversations based on their experiences and trying to inform the public about the threat of this problem and how these groups, recruit and how people get involved. So there's a, kind of a group of formers out there who are really committed to try and inform the public about this problem.
All right. Well, Dr. Simi, well, the first thing I want to do is I have some more questions I want to ask you, at least one more, but I want to thank you for your work, and you were very calm with it, but I just want to be very clear. Um, the vast majority of folks in their academic life are not in any way, shape, or form dealing with death threats. So I want to thank you for your work and your journey in regards to this and being committed to this, because although you're very calm saying it, that's very serious. And I asked that question for a reason, because I had to suspect that you were dealing with that, and not everyone really, most of us would not really have honestly the courage to do that. Because that's very serious. So thank you so very much, sir, for all the work that you're doing.
Well,
um,
thank you. I appreciate that.
Next question. You've been involved in this work for 25 years. What do you think is, what are, if you could maybe point to 2 or 3 next steps that you would like to see in terms of the field moving forward and understanding white supremacy? What are 3 things on the Dr. Simi wish list that you'd want to see happen, that you think would
Okay.
be of impact?
It's always nice to have a wish list.
Yeah.
So I've got a few things, and they're
All right.
quite different from each other. The one would be, and this is very broad, and it's very, I think, consistent with the time that we live in, having just experienced 4 years of a president who spoke the language of white supremacy in a very overt and open way, and yet still received 75 million votes for a second term. So this is the world the moment we're in, and we saw obviously an insurrection at our nation's capital on January 6th, where again, very large turnout of people, obviously smaller number, but still large number of people actually participated in the siege on the Capitol. We have about, I guess, 50 million people or so who think the election was stolen. So we're in a moment now that makes it undeniable how serious and deeply entrenched this problem is. We have done everything in our power over the years to minimize and deny the problem. You know, even in the wake, if you think about, if we go back to the 90s and Oklahoma City, you know, is April of 95. And then you have the Olympic Park bombing just a little over a year later in Atlanta in the Summer Olympics of 96. And then just a couple years later in Jasper, Texas, an African-American man is beheaded. Of course, we didn't call it a beheading, but certainly that crime certainly received a lot of attention. But all of that happens within just a matter of a few years, and yet it still wasn't enough for us to really reckon with this problem in a sustained way. All of those things got some degree of attention, and we said, you know, that there's an issue here, but we didn't do it in a sustained way. And so I'm very concerned that even though now we seem to be tackling this problem in a different kind of way than we have in the past, the question isn't what's happening today, it's what's going to happen tomorrow. Can we sustain this attention? And I'm not sure, to be honest with you. So that's one thing that I'm looking at closely. And I think part of it is our understanding. Are we going to understand the problem in terms of white supremacy being at the core? So are we going to get distracted by different groups and whether they're white supremacists or not, or whether they're anti-government or this, that, or the other? Or are we going to see this problem for what it is, which is white supremacy is at the core? And it's, in many respects, it's not even about groups. It's about an emotional and cognitive network. That it's a worldview that's present in our society and has a stronghold that we've just never really confronted. So that, I guess that's one issue. Another quite different, although I suppose that everything's related, was I would love, and I'm partnering with a neuropsychologist at the University of Delaware, is to move more in the realm of kind of neuropsychological approach to understanding some of the aspects of how hate takes hold and persists. And we'd love to get some people, actually, you know, some former white supremacists in the lab that she has at the University of Delaware, and do some neuroimaging experiments, possibly even try and get some active members into the lab. And so kind of moving in this kind of a neuro kind of sociological, psychological direction, for me, I think is really important to give us another kind of leverage point for understanding the problem. And I'll just stop at 2. So,
Dr. Simi, yeah, I agree with everything that you said. I want to leave on your words. That I want the audience to listen very clearly to what Dr. Simi said. And I want to thank him so much for appearing on the Sidecast. And actually, I'll say this, Dr. Simi. Look, anything that I can do to assist you, or if you need my assistance in any of my capacities, you give me a holler and I'm there.
Thank you so much,
brother. I mean that. You give me a holler and I'm there. You got it.
I really appreciate that. And I'd love to continue this conversation.
Okay. All right. Thank you so much.
Thank you.